Hey everyone, it's Michael here at Home Health Success Academy, and welcome to our Module 13 in our How to Start a Home Care Business video series. And in this video series, our goal is to be able to give you guys every information that you need to be able to start your own home care company. And in this video series, we're talking about this video right here. We're talking about the client services that you need to be able to provide for a client. Now, in previous videos, we talked about how to be able to create a feasibility study, putting together your business plan, how to create that sales process, and to market your company out there. We also talked about the basic type of workers that's going to be working for you in your organization. And our goal in this video series is really to give you every information that you need to be able to start your home care company, whether you're starting a franchise or making a decision to do a home-based agency, or to get an office out there and start your agency in an office space. Either or, we just want to say thank you so much for joining us in this video series, and our goal is to be able to give you everything that you need to create that successful company. So let's talk about the client services. Providing quality client services is achieved through developing a good working relationship between your agency, your home care assistants, and your clients. Clients must be the central focus in this relationship. Okay, and we're talking about not just the clients that you provide the care to, but their loved ones or the referral sources that wants to be able to refer patients to you. Service needs to be provided in a way that preserves dignity, treats each person with respect, is safe, and safeguards privacy. Every one of your clients should have, and definitely will have, a unique personality, their own history, certain likes and dislikes, wants and needs. They may have strengths and weaknesses, and a wide range of experiences. The services must be delivered in such a way to recognize this and maintains the person's independence. And that's the reason why they're using caregiving services, because they want to stay at the comfort of their home rather than going to a nursing home or to a senior living facility. To achieve a high level of quality service, you should apply the following. You must have efficiency. Service and or referrals are initiated the right way, in that you actually have a good service program and how to be able to onboard a particular client. You must provide fairness. The process of providing customer service must be clear that all the terms and conditions of the services. It must be cost effective. Service is cost efficient and competitively priced. Now, there's nothing wrong being the highest priced person, but make sure that you deliver more services as much as possible. I always tell people, don't be the lowest agency as well, because that prevents you from being able to find the right type of care people to provide the care, and at the same time as it limits the ability for you to be able to provide more services for the client. You must have satisfaction. The client must be satisfied. They must be satisfied with the services that you deliver. And if they are not, find out what you need to do to be able to solve the problems. Find out what you can do more for that particular client to make them happy. That is the best way to be able to keep the clients and get more clients out there. You must understand that you must be flexible. Flexible services which can reflect clients' current needs. Sometimes certain clients may need services in the morning, or maybe in the afternoon, or maybe somebody to come in at night, or for 24-hour services. Either or, you must be able to show that you have flexibility for the client, because that's how you're going to be able to get them to stay with your agency. Think about cultural considerations. Home care assistants work with people from many backgrounds, and our caregivers also come from many backgrounds, who have different values and different beliefs. They may find other people's practices or beliefs to be odd or strange, as they are different from their own. Home care assistants may notice that all kinds of opinions, thoughts, beliefs, and behaviors are different from their own, including religion, attitude about disability, attitude about work, importance of family, and whether or not the family should be involved in decision making, importance of punctuality, attitudes about seniors, food choices, or displaying or not displaying any emotions. There's also personal boundaries in client services. When dealing with clients, it is important that the home care assistant keep their working relationship on a professional level. Since the relationship could evolve into one of those friendship in a very short time, this is easier said than done, because home care assistants are caring for their clients' personal and intimate needs. Because their heart are in the right place, clients/families could take advantage of them. By remaining professional, future problems and expectations can be minimized. There has to be a boundary between professional and friendship. And no matter what, when you are getting paid for services, it has to be in a professional business manner. But at the same time, providing care, making sure that you want to provide great care for them and provide the services that they need, but trying to keep it in that level of a business aspect of things rather than a friendship aspect. We must always adhere to the client's Bill of Rights. And you must put that in place into your policies and procedures. But right here is a quick summary of certain privileges and liberties considered essential to a group of people. And so we want to be able to share that to you, right? So the clients have the right to be spoken to or communicated with in a manner they can understand, be told about their rights and responsibilities by the agency, choose what home care assistant they want, be treated courteously, have their property treated with respect, have privacy while receiving care. They should expect safe and competent care at all levels. They should participate in the development of plan of their care. They should be and always should be informed of caregivers who will be delivering the services. They should have a say in when the services will be delivered, have a say in the expected duration of the care, and many, many more. Let's talk about personal information and privacy. Personal information is any data about an identifiable person, which includes information about his or her home, address, contact number, family, career, education, finances, health, activities, opinions, beliefs, and even comments that others have expressed about them. It includes information in any form. When clients obtain home care services, they must disclose a lot of personal information in order that their needs can be identified and remedial care plans can be actually developed. There's confidentiality. Confidentiality is an ethical principle that information relating to the client is kept secret unless the client gives permission to disclose that particular information. Home care assistants work very close with clients in their homes as well as their families. What they hear and see in the home environment should remain private. Breaching confidentiality could have major consequences such as a job loss or a client loss. And so we want to be able to make sure that our team is prepared and aware of what our rules are in our policies and procedures regarding confidentiality. There's also guidelines for disclosing confidential information. The information provided must be limited to the minimum amount of information necessary to accomplish the purpose for which it is being disclosed. The number of people informed must be restricted to the minimum number necessary and only to the people who actually should have those information. The information should be provided in a way that minimizes the identification of the clients. So this is where your agency must put together certain provisions, certain policies and procedures. In the organizations that I lead, that I manage, I make sure that the staff who provides care are aware that they cannot take any pictures with the clients. That is one policy that we actually have. When we do take pictures of our clients, we make sure we get their permission and we can control the pictures or the videos that we are taking. So these are things that you need to be able to make sure is in place. For our software that we use for our client services, only the caregiver who's providing care for that particular client has access to that, or anybody in the office has access to that particular client. Now, once that caregiver gets reassigned to another client, they will no longer have access to our client's information because they are not giving direct care for that particular client. What are the ethical guidelines for home care assistants? Ethics are moral codes which guides the members of the profession in the proper conduct of their duties and obligations. They deal with behavior that is right or wrong and involves applying judgment and making choices about what or what not to do. Application of good ethics is not only expected of home care agencies and home care assistants, but is also an understood rights of clients. Let's talk about work ethics for home care assistants. This is something that you should look into and you should expect from all your caregivers. And if they cannot provide good work ethic, then it's time to let them go. Work ethics deal with behavior in the workplace. Employees need to be aware of how their work ethics affect others. Have you ever worked with somebody that did not have any ethics at all? I'm sure you have. I have plenty of times. And with the agencies that we provide services to, with the agencies that we run ourselves, we always make sure and live up as much as possible to our ethics and expect all of our employees to follow the rules and regulations that we have in our company. Technical skills alone are not enough to meet the employer's requirements because they know only too well the high cost of hiring, firing, and replacing employees. So we need to be able to make sure that everything is involved, from a properly trained staff member to provide the right care, but they also must be aware of the variety of different confidentiality information they must protect, and must be ethical with everything that they do when they provide the services. Let's talk about professionalism. Professionalism involves caring about clients, self, and others while maintaining personal and industry standards and values. There are many characteristics which define professionalism, including maturity, reliability, integrity, honesty, responsibility, accountability, and compassion. So professionalism involves producing quality work, meaning that you are going to make sure that whatever you do, you provide the care that the client actually deserves. Being on time for work and other activities. Have you ever worked with somebody that was always late? How did you feel about that particular person? It's the same exact thing. When you have a team, a staff, they must be coming to work on time. Now, we can never fully see what's going on because all our staff members out there are providing care at our clients' homes. So we can't fully check live at every moment if they came into work on time. But there are softwares out there that allows you to be able to figure that out and to monitor that. There's softwares out there right now that when the client clocks in, it actually tells us where is that particular caregiver at when they sign in to work. So you'll actually see, are they actually checking in while they're at the door of the client? Or are they checking in at home even though they're not in front of the client's home yet? So you want to be able to make sure that you actually have these type of things. It makes it easier for your payroll services, but it makes you able to be able to monitor the professionalism of your team out there. And your team should also maintain appropriate attire and hygiene, okay? We're providing good care to clients. The last thing you want is a home caregiver who smells, okay? And who does not dress up, correctly. And so how do you make sure that things are going on well? Well, number one is make sure they have a uniform that you expect them to wear, whether this is something that you provide them or you tell them what colors they should be wearing when they provide the care. So there's a variety of different things to be able to act and to be able to show professionalism. And the main thing for this is to be professional so that we can show respect to the clients, the families, as well as coworkers. And another thing is, in professionalism, it's always good to be able to accept any feedbacks. Not being disruptive, not being disrespectful to a person by telling them that they can do certain things to improve themselves. It's not being disrespectful. It's about us being able to give them feedback. And for a person to be professional, they must be able to take that particular feedback to them and see how they can improve themselves as much as possible. Personal hygiene. Hygiene is the act of promoting health through personal cleanliness. So that includes bathing, showering, oral care, cleaning and maintaining fingernails and toenails. Oh, by the way, talking about fingernails, I don't know why that some people think that they can have really long fingernails while providing good quality care and become very hygienic. If you're not aware, fingernail polish cracks. They have micro cracks that you sometimes cannot see, and those micro cracks are actually places where bacteria can grow more. And so we want to be able to make sure we provide great care. In nursing school, that's one thing we teach. You can't be working in the field if you have long nails. And the funny part about this is this: a lot of people out there will say, well, I know someone that works in the field that has long nails and nobody says anything about that. That's great. Good for you. But in the company I work for, in the company that I run, I don't allow any long nails. And that is something that we do actually check on a regular basis. You have to understand, hygiene can also apply to the care and maintenance of assisted devices, such as eyeglasses and hearing aids, to ensure proper functionings. So you want to be able to know that you're providing, good care to the client, keeping them hygienic and keeping yourself and your team hygienic as well. And just to add to this, just to let you know, washing your hands is the #1 prevention of any infection. Teamwork. Teamwork is so important, right? So teamwork involves a group of people working together to meet the various needs of a client. The team is usually comprised of the representatives from a variety of disciplines, backgrounds, and professions. By uniting together, they can provide more effective care as a group than any other person out there by themselves. So with home care, each member of the care team is expected to contribute and cooperate with the other team members to ensure optimum care is given to clients. Let's talk about elder abuse, right? Elderly who are unable to take care of their own health needs, who require constant care and or who are financially dependent, are the ones who are most susceptible to abuse. This includes those living on their own with in-home support, those living with families, and those living in facilities. Even the elderly, who are quite mentally capable of taking care of their own needs, can be vulnerable to elder abuse. We see this time to time basis online how a lot of caregivers, nurses out there, even physicians out there, even personal lawyers out there have abused an elderly at one point. And we're not just talking about sexual abuse or verbal abuse, we're talking about financial abuse as well, and a whole variety of different ways a client is taken advantage of. And we want to be able to make sure that we notify the team that we have in our office, notify our caregivers in the field that this is not going to be tolerated. And so you should have policy and procedures in place on what happens when something is discovered. So moving on to the different types of abuses, like I said earlier, there's the physical abuse. It's the willful infliction of physical pain or injury, such as hitting, slapping, kicking, pinching, beating, lashing, and whipping. There's verbal abuse, which involves unkind gestures, uttering or writing unfavorable words, scoffing at, criticizing, or denouncing a person. There's involuntary seclusion, confines a person to a specific area. There may be financial or material abuse. There may be emotional or psychological abuse. There's sexual abuse. There's even neglect. Neglect is the failure of a caretaker to provide goods or services necessary to avoid physical harm, mental anguish, or mental illness. There's even self-neglect. It's characterized as the behavior of an elderly person that threatens his or her own health and safety. Let's talk about the signs and symptoms of elder abuse so that you can know how to be able to recognize this. Home care assistants should be alert for signs of elderly abuse. So home care assistants need to see, hey, is the family member or is the full-time caregiver providing, some bad services or is abusing the client that we're providing care for. So here are the following red flags that could indicate that abuse is taking place. There's the unexplained physical injuries, depression, fears, anxiety, inability to explain withdrawals from banks, loss of possessions, fraud. There may be the elder's use of an ATM when they are unable to leave the homes. There may be numerous cash withdrawals. There may be increased activity on credit cards. There may be a change in account beneficiaries. And there's a new authorized signers on the accounts. So these right here are just a few of the signs and symptoms of elderly abuse out there. So I hope this quick video was able to give you guys some great information so that you are aware on what type of services and how we're in need to be able to provide a great care for our clients, especially when you own your own home care company. So if you have any questions, always send us an email or give us a call. We definitely want to be able to help you create your own successful agency. If you need help with your marketing strategies and to learn everything else out there that's going to be vital to be able to get your company out there, to be able to increase your profits, increase your census, and get you more referral sources, stop by 10xpatientreferrals.com. We have an online marketing university that provides you all the information you need to be able to learn how to be able to market your agency out there and create a successful agency.